For our update today, we actually have 95 new cases of COVID-19 in the province today, bringing our total up to 1,948. And I'll address a little bit in a minute where those numbers are coming from. That includes 778 in Vancouver Coastal Health Region, 853 people in the Fraser Health Region, 115 in the Vancouver Island Health Area, 160 in the Interior Health Region, and 42 people in the Northern Health Region. We have no new long-term care facility outbreaks today, and one additional outbreak has been declared over, so that we now have 11 long-term care facility outbreaks that are over. Part of the reason that we've had such a dramatic jump in cases today is related to the community outbreaks that we've been investigating. As you are aware, we've had an ongoing outbreak at the Mission Federal Correctional Facility, and we've done extensive testing within that facility in the last few days. And so 40 of the additional cases are related to people who were detected at the Mission Correctional Facility, bringing up the number of inmates who've tested positive at Mission to 106, and 12 staff members who are positive from the Mission Institute. In addition, you're aware that we've had 2 ongoing outbreaks in workplaces, including Superior Poultry, and 16 of the new cases today are related to the ongoing investigation at that facility. The United Poultry facility, which was closed down a few days ago, remains at 35 cases positive there. And we are now up to 11 positive cases that are associated with the Curl Lake industrial plant in Alberta. In terms of our cases, we have 96 people who are in hospital at this point, and 41 of those people are in critical care or ICU. We've had 1,137 people who are now considered fully recovered. Tragically, we continue to have deaths related to COVID-19, and we've had 2 additional deaths in the last day, bringing our total people who have died from COVID-19 to 100 in British Columbia. Included in the deaths, though, in the last 24 hours is our first death in one of BC's First Nations communities. Along with the many lives we have lost to COVID-19, this is a tragedy that's beyond just us. It's a tragedy for all of us. Our elders, in particular in our First Nations communities, are culture and history keepers. When they become ill and when they die, we all lose. And I want you to know that we feel that collective loss today. My thoughts are with her family and her entire community, as I recognize the tragic impact this has on all of them. It's particularly a challenging time to not be able to come together physically in the normal way that we would, to respect the customs that we have in communities at this time. And my condolences and my heart goes out to this community and to the family. As we continue to move forward in our COVID-19 response, it's important that we don't leave anyone behind, particularly people who I know are dealing with many different crises, including people who use drugs, people who are underhoused and homeless. Everyone in BC deserves to feel safe, protected, and supported through these crises. Safe physical distancing and self-isolation, if you're ill, can be really difficult when your housing is precarious. And this is further compounded for people who may also be living with mental health and substance use or addiction issues. We have not forgotten that we have 2 public health crises, 2 public health emergencies that we're dealing with in this province. The first of those has been going on for some time, and that is our overdose crises. And now, compounding that, is the COVID-19 outbreak. For people who are dealing with both of these challenges, daily life can be very much a struggle. Today, the province announced over 1,000 hotel rooms to to provide safe housing for people living in encampments in Victoria and Vancouver, and a plan, and importantly, a plan to support people in housing, but also to ensure that they have the mental health, the physical health, and the social supports that they need and that we need, so that we can support people who are living with mental health and substance use issues, with addictions, and with homelessness. We cannot address COVID-19 in isolation, and we need to make sure that we're supporting those people who are the most vulnerable in our communities. This action is welcome news. It reduces the immediate health and safety risks that we know were a challenge for people living in these encampments, and it's important for us in the health sector to be sure that we can support all of the needs of people as they are transitioned into more stable and important housing over the coming days, weeks, but also the months and years to come. This is not a short-term plan, and we in the health sector will be providing supports to our people in our communities going forward. I also, from the outset, have spoken about the importance of keeping safe physical distance from others and staying home when ill. These are the best and the most important things we can do to bend the COVID-19 curve. But in many cases, this has led to increased family stresses and decreased community connections. And unfortunately, for some, being at home means not being safe. We know domestic violence, intimate partner violence, and interfamily violence can sometimes increase during crises like this one. If you are experiencing violence, it's not okay. And we want you to know that you are not alone. There are resources that are out here that we have that are available for you. If you are in immediate danger, call 911 and get the help you need. You can also call Victim Link BC. It's a toll-free, confidential, and multilingual telephone service that's available across British Columbia 24 hours a day, 7 days a week. Trained support teams can give you the information and refer you to services that you may need. Your immediate safety is more important than physical distancing or self-isolation. And that is important for people to recognize. There is help out there for you, and we can connect you to the supports that you need. There is more information about this on the BC CDC website, but people can also, as I said, connect with Victim Link BC. You can call 1-800-563-0808 or email victimlinkbc@bc211.ca. There's also more information on the BC CDC website about how you can text or send notes if you're not in a safe position to call. Please know that these supports are out there for you. We will get through this. This is a challenging time, and it's becoming complicated for all of us. And I know people are tired, and sometimes this can be lead to stressors that we may not know how to deal with. We will get through this, and we'll be stronger by taking care of our loved ones and taking care of each other. We need to continue to be kind to each other, to be calm through this crisis, and to stay safe.